Good afternoon, and welcome to Let's Talk on Win TV. I'm your host, Denise Rollard Barnes, publisher of the Washington Informer, and welcome to my cozy little office. I hope you all don't mind all the junk, but we just celebrated our spelling bee and all kinds of things going on. So, I love to have my space as you all, I go into your space, right? On your cell phones, on your laptops, your computers, whatever the case is. I welcome you, and I appreciate that you are welcoming me as well. But at any rate, as you know, it's Friday, April the 10th. Beautiful day. We're getting ready to have some warm temperatures next week. So get ready. We've gone from 30 degrees earlier this week to 90 degrees in a couple of days. So I hope that you all have been weathering the weather, if you know what I mean. Anyway, today we have a wonderful lineup of guests. We're kicking off things with a lot of issues, some essential discussions that touch on our lives, our community health, and the well-being of our families. Joining us today is Emile C. Thompson, who is the chair of the Public Service Commission, to discuss the complexities of utility rates and how these rates are determined, their impact on our daily lives, and what consumers need to know to navigate this crucial aspect of public service. He will also talk briefly about clean energy initiatives. We all are kind of like, I don't know, scratching our heads and wondering where we're going to get the money to pay these electric bills, to pay gas for our automobiles. The summer's coming. We don't know what those rates are going to be. Public Service Commission has really nothing to do with water bills, but that I don't think. Now, Emile will correct me on that. But even the water bills are going up. Everything is going up except our salaries. So anyway, we're going to talk to him to see how the Public Service Commission is addressing that, and to answer any other questions that Emile is prepared to answer. And then next week, we're going to bring awareness to Black Maternal Health Week, which is coming up. I should say next. We're going to bring, it is next week. Black Maternal Health Week is next week. It begins tomorrow, April 11th through the 17th. And so today we're going to talk about Black Maternal Health Week. And we're going to be talking to John Wiley, who's the community representative and designer for Wellpoint. Kind of discuss their work with a few community partners to expand access to care and support underserved populations, particularly in areas like maternal health and infant health. And then finally, on that same topic, Jaren Hill, chair of the Ward 8 Health Council, one of the Wellpoint community partners, will be with us to discuss some of her organization's initiatives. The council is leading efforts to improve maternal health outcomes east of the river, east of the Anacostia River. For those who are not in the DMV, it's like across the tracks, we're across the river, by expanding access to culturally competent care and supporting community-based models such as doula services. If that doesn't sound familiar, Jarren will fill you in on what that's all about and how those services are being provided to residents east of the river. But before we jump into our first conversation, be sure to pick up your copy of this week's Washington Informer. It's on newsstands near you, but if you can't get a printed copy, you can pull up the digital edition online by visiting our website at washingtoninformer.com. It's really simple, washingtoninformer.com, one word, and that's in front of you. And that way you can get a copy of the digital edition, but you'll get so much more of the news we've been covering throughout the week. Everything can't go into those pages of the newspaper, but our staff is constantly covering the District of Columbia and putting stories out there that we hope that are informative, inspiring, and that information you can use. So pick up a copy of the Washington Informer. We're over stands throughout the city, including Virginia, Maryland, Prince George's County, and Montgomery County. So there are places all over the city where you can get a copy of the Informer. But to make it easy on you, just visit washingtoninformer.com. That's where you can get the digital edition and so much more. And we invite you to become a subscriber there. There's a link. All we ask you to do is to give us your email address, and you automatically become a part of the Washington Informer family. You can receive our weekly Win Daily newsletter so that you can keep up with the local news that we're reporting every day. And then there are other newsletters there that you may be interested in. We also invite you to share this broadcast and your social media with your social media friends, followers, your followers, um, on platforms including Facebook, IG, X, TikTok, LinkedIn, and YouTube. I could probably name more, but I won't. There's so many social media platforms out there, but your favorite, whatever your favorite is, just look up washinformer.com or washinformer, and you can find us there. You can also subscribe to our YouTube channel at Washington Informer TV, just one word, Washington Informer TV. There's so much there that you can see. I feel excited to be able to talk about all the stories and great news that we've been doing over the years. The Washington Informer is now 61 years old, but every week our fantastic staff is out there trying to cover the news and to make sure that you're informed and to give it to you on all platforms so you can see all of our former videos, including this show, at Washington Informer TV. So check it out. Check it out. We're going to move on and get into the topic of our program today. So joining us now is Emile C. Thompson from the Public Service Commission. I want to welcome him. Welcome you, Emile, to Let's Talk. You there?
Yes. Thank you for having me as always, Denise. I really enjoy coming and talking. So looking forward to the discussion today.
No, wonderful. I mean, this is a tough time. There's so much going on, in the city. And so I'm glad that you're always making yourself available to help explain things to our viewers, because one of the big news right now is the rise in these utility bills, but particularly in electric bills. Nobody knows where to point the fingers, but there's only one place I guess they can go for help, which is with their electric provider, and in this case for the district, it's Pepco. But let's talk about that. I mean, what is the Public Service Commission actually doing right now to address this rise in electric bills?
Yeah, so I think it's helpful to give just first a little bit of context, right? So the Public Service Commission is charged with ensuring that the utilities it regulates provide safe, affordable, and reliable service. And I heard you say earlier you weren't sure if DC Water is under our auspices or under our regulatory oversight, and they're not, because they are quasi-governmental agency. So it's really Pepco, Washington Gas, and Verizon landline services. And when we say we regulate them, we regulate the distribution portion of your bill. So if you ever take a look at your electric bill, you'll see that it's broken out into different parts. There's a distribution component, which we regulate. There's a transmission component, which we don't. There's a supply or generation component. We also don't regulate that. And then finally, there is taxes, and those are set by, of course, DC Council. And so when you look at the electric bill with those four parts, the commission regulates about 27% of that. And so to break it down really simple, if your bill is $100, which I think people would be happy if they had a $100 bill,
Really?
if you had a $100 bill, the DC commission can only affect $27 of it. And I think that's a real thing that people need to understand, because when we start talking about what's driving costs, how to fix those cost drivers, we have to understand what the levers are and who's in control of those levers. And so, again, the commission controls 27% of it. And the way that we set that 27% is one of the so Pepco will come to us and ask us for a rate increase. And we'll have a very complex, basically court case with the Office of People's Counsel. Sometimes you have the Sierra Club involved. You'll have District Department of Energy and Environment, the federal government, because they are a huge energy user in the district. You'll also have AOBA, the Apartment and Office Building Association, and they all come in and they're all challenging how much Pepco says they need in order to recover um, they recover the cost that it takes to build infrastructure throughout the city, whether it's the lights, the poles, the workers who come to your house to check the meters, what have you. And then ultimately the commission comes to a decision on those costs, and we issue an order. And that's how they're able to charge for that 27% of the bill. The largest part of the bill, which is 58% of the bill, is a generation supply. And what we've seen over the last 2 years is that part has really increased. When I first started, it was about it was about 51% of the bill, and now it's going up to 58, and that's because of issues that we necessarily don't have complete control over. And one of them is we hear a lot about data centers and how they use a lot of energy, and so as they use more energy and less energy is coming onto the grid, that makes the price of energy increase. And so we've seen costs increase there. We've also seen the compliance fees associated with our renewable energy portfolio, our clean energy goals, go up. And so that has been a cost driver. And so we have to look at all these issues to figure out the best way to really solve the issue of rising costs. But as you stated earlier, the price of everything has gone up. And so we have to figure out what we can do.
There's so many layers to this conversation, and everything that you mentioned, I could come up with 5 questions or more about that. But I want to go back a little bit, Emile, and I don't know if you can really. I'm trying to understand the history, of the mission, because back in the day, I mean, I can only go back but so far, but I can go back. There was once upon a time something called the Washington Gas Light Company, right?
Mhm.
And so they provided both gas and electricity, if I'm not mistaken, in the district. So after, I mean, when did the Public Service Commission, what's the age or history of this organization? And why was it created?
Right. So Washington Gas Light, interestingly enough, was always, at least my understanding, is always a natural gas company, but they
Okay,
used natural gas for lighting at one point. I believe that's the case.
okay,
But to really answer your question, the commission has been around since I believe 1913, 113 years old.
okay.
And what you have is you have public service commissions across the nation because you have these what we call regulated monopolies. It was determined that it was more effective to have one company owning the poles instead of having 10 different companies having poles and mismatched across the city. One company doing and owning that infrastructure because it costs so much to do, and it would be and for a number of reasons it was much more efficient, cost effective for one company to own them. But as a result, you have a public service commission who then regulates them and ensures that the service they're providing is safe, it's affordable, and it's reliable. And so every state across the United States has a public service commission. Overseas, they have the equivalents. They have different names, but this model is not unique to the United States or even to the district.
Interesting. Okay. So, I mean, it goes way back, and it certainly does help. And this is one agency few consumers know anything about, but it's almost like a quasi sort of advocate for consumers to try to make sure that that there's a process for utility companies that they have to go through before they can just automatically increase rates. Right.
Correct, correct. And we really we would call ourselves a quasi judicial body because when we're making rulings, we're acting as a court, and we're making rulings. Our rulings are appealed to the Court of Appeals if somebody has a problem with.
Well, speaking of problems, I'm thinking we're having. Are you there, Emil? You there?
Sorry, I think yeah, yes. Can you hear
Yeah,
me?
we lost you for a second. You said if you have a
Okay.
problem, I'm like, oops, I think we have a problem. But go ahead.
Sorry, sorry. We operate as a court, a quasi judicial agency. We make rulings. If people don't like our rulings, they can appeal to the Court of Appeals. And then we have parties that come and argue before us. So the Office of People's Counsel represents district residents
Okay.
You'll have the Sierra Club who comes and represents the environmental advocacy, and then you have different groups that represent their respective constituencies.
So, with this increase that people are experiencing, particularly in the electric bills, was this something that the Public Service Commission kind of knew, ahead of time that stuff I'll say was going to hit the fan pretty soon, and residents were going to be up in arms? I mean, did you know that this was coming? And
So
what?
so we knew about some of the general trends that were coming, right? So we knew that because of data centers, electricity on the supply side was going to go up. We didn't know the magnitude. We knew certainly that the compliance fees, as we get closer and closer to our clean energy goals, are going to cost more and more each year. Um, with respect to data centers, we sent letters, we issued press releases, but I know that sometimes that does not get to everybody, right? We sent letters to the council saying this is happening. We put press releases out saying that there are going to be increases. But also what we know has happened is December, January, and February were much colder, and the usage of electricity was much higher than the preceding 3 years. And so it's almost like you just layer event on top of event on top of event, and it creates a perfect storm for somebody opening their bill and saying, "Wow, my electricity has really increased. What's going on?"
So, is there does the Public Service Commission play any role in kind of addressing these increases? I know that PepCo, for example, has a program, which I think it's become a political debate right now as to who should have done what and when, and is it too late, and will this address the problem or not? But does the Public Service Commission offer any kind of support to residents in a situation like this?
Yes. So the first thing I'll say is, if you feel if you believe your bill is wrong, please come to us. Right? We have no problem verifying that the bill is correct. We want to make sure that people have accurate bills. But on top of that, we certainly offer utility discount programs for both Pepco and Washington Gas. Now, here's the trick: we only offer discounts for the part that we control, which is 27% of the bill. Now, if you qualify for one of these discount programs, you get a discount on that 27% of your bill, but there's still the other 73% that has to be paid. And so what we've started trying to do is engage, because it's not something, again, that we necessarily control, but there are different levers throughout the city we can try and work with our partners, whether it's the council, whether it's what's going on at the grid at large, to try and figure out solutions for the other part of the bill. Because without fixing that part, that 27% is only 27%. And so it really takes a holistic approach, and it's not just the commission. But again, to answer your question, we have the utility discount programs. We want to get people enrolled in those who qualify, 80% of the area median income, and really get them enrolled and get at least some assistance. DOEE also has a LIHEAP program, which provides payments, and also can offer people access to community solar and solar for all, which will help on that other part of the bill that the commission does not control.
It's interesting because I think the district was really aggressive at one point. The whole nation was, in dealing with alternative energy sources. Um, and then we had a presidential election, and I won't go any further. But as a result, it doesn't seem to be as big a push on some of these alternative uh, sources. And now we're in a war, right?
Right.
Which is also having an impact on costs.
Yes.
But you talked about the goals. What did you call them?
The clean energy goals. Yes.
Energy goals. Tell us a little bit about that, because evidently that's still going to impact prices. Okay.
Correct.
Mm-hmm.
So in DC, what we say is that by 2032, all electricity is going to come from renewable sources. and that by 2041, 50% of the electricity will be generated from within DC. So to incentivize, to encourage that adoption, we have compliance fees. And if you don't meet your targets, you have to pay this compliance fee. Because there's a compliance fee, trying to explain it as simple as possible, but because you have these compliance fees, to get the renewable credits, the price of the renewable credits go right up to the compliance fee. So the people who provide the electricity have to either buy the credit or buy the compliance fee or pay the compliance fee. And then that gets passed back through customers as part of the bill. Part of our analysis has shown that 15% of your electric bill is due to compliance with the clean energy goals. And so that's, again, not something that's set by the commission, that's set by the council. And, one possible idea there could be, we don't have to go back on our goals, but maybe we change the compliance fees, right? And therefore the compliance fees aren't as high. So that if we're not making them, it's still, we're still trying to move in the right direction, but maybe compliance isn't as costly, thereby providing some savings to customers. But that's a conversation that has to be had at a larger level with all the relevant stakeholders in the room.
Yeah, it sounds like one day we here at Let's Talk need to have maybe yourself or someone from, the utility company or somewhere and just look at a bill.
Yeah.
And go through each. You mentioned, if you feel like if your bill is incorrect, well, a single person living in a house who's used to paying $150 a month now is being charged $400 a month.
Right.
Of course, they're going to think their bill is incorrect, but they won't know what part of it is. Is it the 27%? Is it the 57? Is it the, all the different things that you're mentioning? And for us to be able to understand, and I'm saying us because we're all impacted, including you, right?
Oh yeah.
Unless you know somebody and
no. They might be charging me double. I don't know.
So, just to be able to, because we all can't come running to your door and saying, my bill is wrong. I've been living in the house, I'm using the same utilities, and now I'm paying $200 more, right? So, really understanding what this bill means and how we can monitor it better. Is there anything you would tell consumers to do or bill payers to do? What numbers should they really be looking at when they get their utility bill?
Well, so your utility bill is all driven off of usage, right? And so you use X amount a month, and then depending upon the certain categories, it's multiplied by the rate. And so when you're looking at your bill, the quickest thing that any individual person can do or family is reduce usage. And it's hard. We're getting ready to talk about the hot weather that's coming up. You want to keep your thermostat at 69. Maybe that's not the thing to do. Maybe you need to keep it at 73, 74. Wear shorts in it. Right?
You're going to cut it off until it's too hot.
There you go. But yeah, I think we're in a space where we need to think more and more about conservation. We have long said that the cheapest kilowatt is the one you don't use. Right. And so figure out how we can reduce usage. But we also know that electricity is an essential source, right? For our TVs, our computers, our appliances, our cell phones. And so trying to figure out what that right balance is. There's also energy efficiency, a lot of energy efficiency programs in the district. DC SEU has some wonderful rebate programs around weatherization. We do a lot of work around weatherization in a couple of months. I think next month, maybe we may be kicking off our Summer Ready, where we give our weatherization products that help with energy efficiency. And so I think the quickest things are reduce what you use, figure out energy efficiency programs you can enroll in. And then if you are able to qualify in terms of one of the discount programs, certainly do that. Utility discount programs, there's some senior programs, and all those can be found on our website at dcpsc.org.
Okay, I think we're going to put that up.
Okay.
DCPSC.org.
You got it. You got
Okay.
it.
Now, two more little questions before we go, and I really appreciate you taking this time with us today. One, April 22nd is Earth Day.
Yes.
And we really celebrate Earth Day here at the Washington Informer. We do a special issue, and thank you
Hmm.
for participating. But what is the commission doing? How are you all acknowledging Earth Day here? And is there anything folks need to look out for?
So we don't have a special Earth Day program, but I would say, Earth Day is something that's certainly intricately intertwined with what we do, right? So when we start talking about our renewable goals, right? Clean energy goals, that's about preserving the earth. And so we do a lot around ensuring that solar panels, solar facilities can interconnect in a timely fashion. So we reduce some of our dependence on fossil fuels. We're also having in May, and I'm not sure if we've reached out to you yet, but we're having an affordability summit. And part of that affordability summit, we'll be talking about the intersection of sustainability and affordability and how we can really bring those two together so that we're not creating unintended costs, but also preserving the earth. And so would love to certainly engage with you more on that and make sure you guys have that information. But we certainly believe Earth Day is very important.
Yeah, I would love. Yeah, we look forward to covering and participating and announcing, what you all are going to be doing. I think back, a lot of times people used to say, this whole Earth Day sustainability thing was not something that we, as Black folks, really cared
Mm,
about. But I always call us, the original protectors of the earth. That's
yeah,
why our skills and everything else was so valuable because we understood nature and
yeah.
how to make it work for man. But a lot of that we've forgotten now that we're silly city dwellers. We want air conditioning all the time.
Yeah,
Government buildings are the coldest buildings I've ever
they
seen.
are. They
I
are.
don't know if they're gonna, if are they gonna be cutting their bill thermostat?
Well, I know the mayor this morning talked about her budget, and one of her cost pressures are utility bills, just like
Yeah,
everybody else. And so I'm sure that's part of the discussion.
yeah. And lastly, the you talked about the data centers. We don't have any in the district, do we?
We do have a few actually, very small, not the big energy consumers that you hear about in Loudoun County.
Right.
But what happened? The way energy works, at least in DC, is we don't have any power plants, and so we get our electricity from a regional grid that's about 14 states. So sometimes we're getting electricity from Virginia, sometimes it's Pennsylvania, sometimes it's Ohio, West Virginia, Kentucky, because we're all part of the same grid.
Hmm.
And so what happens in one state in this region affects all the states. And so that's a whole nother discussion topic. But
And I'm sure,
that
yeah.
yeah, that's the quick answer to the data center and how it affects us because we're all pulling from the same place.
Right. I mean, we hear about the fights that are going on, like in Prince George's County, what they're trying to do to
Yeah,
reduce the data centers there and the impact that it's going to have. But it's already impacting all of us.
right, right,
Which,
right.
okay. Well, Emil, I want to thank you, for taking this time. I hope that you've
Pleasure.
answered some questions that consumers are having. Again, give us the contact information if folks want to come to you all directly to get
Yeah,
more information or answer questions.
dcpsc.org is the easiest place always to just come to us. It has all of our information. It actually has a lot of great resources. You can also, let me see, you can also call us. I know not everybody wants to get on the website. You can call us. Our number is 202-626-5100.
Okay, let me get you to repeat that one more time.
202-626-5100.
Wonderful. Okay. All right. There we go. That's what I wanted to. That's what I wanted to say. All right. Well, you have a wonderful weekend. Thanks a lot for being with us, and know that the door is always open because we want to keep folks informed and to help them to understand what's happening with these utilities. So I appreciate your time.
Always. Thank you so much. I appreciate it, Denise.
All right, Emile, take care.
Bye bye.
Bye bye. So yeah, I don't if you all are having questions and you don't want to, don't feel comfortable calling or what have you, send us an email at news at washingtoninformer.com. We really do want to hear how these increased utility rates may be impacting you, and finding out what's helping you. It's something, that we all should be concerned about. We're all impacted. And so that's why we want to make sure that we bring these experts on the show to come up with the answers. But if you didn't even hear an answer that will help address your problem, email us again at news@washingtoninformer.com, and we will work on getting a response for you. All right, let's move on. I am really excited to meet and to have a conversation now with John Wiley, who is the community representative and designer of Wellpoint, DC. John, welcome.
Hi, how you doing today?
I'm good. The people in their cars today, where y'all going?
I help the community, part of my job. Just glad to be here.
Oh, good. Okay. All right. Doing your work. So, you are well, tell folks what WellPoint is, first of all. I don't want to tell folks. I want you to tell them.
So, Wellpoint is a managed care district. Can you hear me? Okay.
You're breaking up.
I think I lost you. Can you hear me?
Yeah, I can hear you. Just breaking up. Can you hear me? Hello, hello, hello.
It's slow on my end. It says, say it one more time.
So just yeah, I'm saying I can hear you, but you're breaking up. So I'm just hoping that you can tell our
It's,
viewers what WellPoint is. Not working. What I think we'll do, while you and our producers get that part fixed, I think we'll move on to, because we're in the same conversation. We're talking about Black Maternal Health Week. And I'm really excited to have Jaren Hill with us, who's the chair of the Ward 8 Health Council. Jaren, you in the car too. I tell you, everybody's out there working in the community. How's your connection? Take yourself off mute and tell me what's going on.
I think I'm good. I'm stable. I think I'm solid. I'm in one place, so I think I'm good with my connection.
Okay, really good. And what we might do, because John is having some issues, we might just bring him in a little bit, and we'll just have a group conversation if that's okay with you.
Absolutely.
One of the things I wanted to talk to him about, after you tell us a little bit about the Ward 8 Council, is this statistic from the DC Department of Health that shows that 90% of pregnancy related deaths in the District of Columbia occur among Black residents, with the highest risk for those in Wards 7 and 8. And what those factors are that are causing these high death rates, it says, include, again, systemic racism. That's always an issue. Lack of prenatal care access, and higher rates of comorbidities. This is not new information for us. And now, here you are, you're with the Health Council and an advocate. I've heard you testify. But how do these statistics make you feel? And, what is it that you think is not happening?
Great questions. Great questions. And let me say, I'm a mom first, right? I'm actually at an appointment with my son, so I'm sitting in the car because my son is right inside, handling some things in preparation for spring break. And not only am I the mother of a beautiful Black boy in Ward 8, I also have identical twin daughters, right? And recognizing that Ward 8 is ground zero for the Black maternal health crisis, it is my duty to do all that I can to support, birthing people in my community and giving them the resources that I wish I had bringing my daughter's earthside. So that's really the crux of my passion when it comes to Black maternal health, really trying to be who I needed and create the systems of support that I wish were there in my birthing process of my daughters. And with that, as I'm the chair of the Ward 8 Health Council, I'm really clear that I stand on the shoulders of giants, that I didn't just get here saying that this is a good idea. It's because of folks like you, Miss Denise Rolock Barnes, the Marion Berries of the world, the Wilhelmina Rolocks, right? The Mary Cuthberts, James Bunn, William Lockridge. There's so many people who laid the foundation for me to be able to step in and do the work that I do, specifically with the Ward 8 Health Council, to really advance the health and well-being of Ward 8 residents in collaboration and community with anyone who's really willing to step forward and say that we're going to prioritize our health and well-being, whether that's residents, providers, advocates. Together, we're all really trying to co-create solutions to drive systems change, particularly for, our mothers and birthing people who need it the most.
So, I mean, this statistic, I mean, I think everybody probably has a story, not everybody, but a lot of mothers in the area and dads probably have stories about what's happening with maternal health in the ward. But and negative statistics, we just talked about those. But what is the council doing? What are some of your initiatives to really address this issue?
Great question. I'm really excited to share more work about what our maternal working group has been doing. Our maternal working group is co-chaired by an amazing doula by the name of Crystal Jackson. I call her the most effective doula in the DMV. Not only is she helping
Tell
to
folks what a
assist.
doula is, because a lot of people, I mean, it's a common term now, but there still may be folks out there that say a doula. What is that?
Great question. Great question. So a doula is a person that is an advocate for the birthing person. Right?
Mm-hmm.
Point blank, they are there to support and advocate for the support of the birth and support the birthing person. Recognizing that your healthcare team, the medical team, whether that's the OBGYN, the midwife, the nurses, the pediatricians, they all have their respective jobs to do, right? Take care, get the baby out or, whatever it is that they're responsible to do. But who's really listening to and understanding and advocating for the mother and the birthing person? And that's the role of the doula, right?
Mm-hmm.
That's, she's cold. Let's get her a blanket. She doesn't want an epidural. She's hungry. She says she's in pain, right? So the doula is really there to be an advocate, a cheerleader, and a supporter for the birthing person.
And how does that doula end up in the life of the mother? Where do they just appear in the birthing room, or is it during the process of pregnancy?
That is an excellent question as well. And it's almost like you've been reading and hearing the meetings that we've been having this week. So traditionally, the patient and the birthing person would identify the doula, right? So through your insurance in DC, we luckily have Medicaid reimbursement. So if you are a Medicaid recipient, you qualify for doula support. So traditionally, the birthing pregnant person would find and identify their doula. So through some of the work that the maternal working group is doing, we have the Doula Learning Action Collaborative to make doula accessibility easier for everyone, so that doulas understand how to be Medicaid reimbursed so that the billing isn't a challenge, as well as having some of that back end support of communications and marketing to let folks know how to find the doulas. And again, that is a birth child of the maternal working group that Crystal Jackson with the Queen Mama Doula Services and Leah with Children's Law Center have been really working together, because we recognize that doula support is statistically proven to improve birthing and maternal health rates. Like, it's statistically proven. And so what we're trying to do is embed more doula support into a couple of different ways and mechanisms. What I'm really excited to let you know that just this week, in partnership with Children's National Medical Center, Wellpoint, and the Queen Mama Doula Services, we're trying to embed doula services within Cedar Hill Regional Medical Center. So when you ask how would doulas show up, we're trying to have doulas be on staff as a part of the healthcare team, along with the nurses and midwives and OBGYNs to really advocate bedside at Cedar Hill, which is, our new hospital here in the Great Ward 8. But then I also say we're trying to not just have doulas available at bedside to support during labor and delivery, but also trying to do something really innovative, right? To also include a postpartum support visit as well. When you have that baby, within the first week, the baby needs to be seen by a pediatrician. And what we found out is at Cedar Hill, those pediatricians are from Children's National Medical Center.
Mm-hmm.
Right? So the baby's first pediatrician is already a part of Children's. And so what we're trying to do is create a seamless transition where that mom with doula support can have her child's first pediatric visit at Children's, right? So when you leave the hospital, you know that you can have a follow-up visit at Children's. But then to go a step farther, because we know who our community is and we know who we are. If your appointment is at 1:00, you might be trying to park the car at 12:55 and walking through the door at 12:59. Which, if that's your first baby's doctor's appointment, that's not really the environment that would be ideal to make
Right,
this happen.
right,
So
right.
what we're trying to do is have that doula also accompany you to that baby's first doctor's appointment. So that if your appointment is at 1:00, our doulas would show up at your house or at DC Health or at Grounded or some neutral place that you're comfortable, maybe about 11:30 or 12, right? So we're going to prep you. And then not only are we going to make sure that your anxiety is down, that you have any questions answered, we're going to also embed food into that as well. So the doula will come with a postpartum, nutritionally dense, culturally relevant meal to also, again, reduce your anxiety, make sure that any questions you have are answered, and assist you with that first baby's doctor's appointment. So that's
Mm-hmm.
something that we're really trying to do differently to really create a continuum of care from labor and delivery to that first pediatric appointment to really connect the dots in an amazing, beautiful way. And so we have a lot of folks who are on board with doing that. Children's has said that they'll support. Cedar Hills Women's Services has been phenomenal in their support as well. And I see that we've also been joined by our friends at Wellpoint because we talked to them this morning. They're on board with supporting this as well. So really
Yeah,
excited for like the holistic approach.
wonderful. John is trying to get us all settled over there, but I don't know if we can take him out for a sec. Thank you. Let me ask you this question, Jarren. Because the report also included comorbidities, meaning that pregnant women sometimes are showing up with other kinds of health conditions like high blood pressure, uh, diabetes. I mean, just a whole bunch of other things that impact the pregnancy. Is that an observation that you all have seen as well? And what is the Health Council doing to trying to do to address that? You can't solve it, but
Absolutely. So that's another one of the things that when we talk about that postpartum visit that we'll be screening for, and the doulas will be supporting that as well through
Mhm.
amazing support. Sibley, I believe it was Sibley donated or sponsored and provided a lot of blood pressure cups to our doulas, so
Okay.
that they're able to monitor for hypertension and things like that, to then be able to send the resources and the referrals accordingly. And that's why I'm really excited to also then tap into resources like Link You, which is a platform by the DC Department of Health, to then, follow up with those referrals, whether it's mental health support, diabetes support, food access, or whatever else is needed. So to really look at and be a holistic approach to then moving resources and referrals accordingly.
I heard a statistic this morning that the birth rate in the United States has uh, deeply declined, and they are crediting it to the decrease in teen pregnancies. So when we think about, our topic today, dealing with maternal health, sometimes we're thinking about, oh, those teenagers, blah, blah, blah. But this goes across all age ranges when we're talking about the issues of maternal health. But what are you all seeing as well with regards to the women that, if there are any statistics that you all address that deal with the women in Ward 7 and 8, and who are the ones that are at greatest risk?
One of the things that is interesting about that statistic about the Black maternal health crisis is that it's literally Black women. It goes across age, it goes across income brackets, it goes across education, it goes across where you're located. So this is a uniquely Black women's issue. But then what we also recognize is that we have the statistics to support the data around the maternal health, labor, and delivery because of you may remember maybe like 20 or 30 years ago, there was a really big infant mortality push,
Right.
right? Like, and once we solved for some of the challenges of the infant mortality, right, we then were able to shine more of a light on the Black maternal health crisis, which then, you know, directly ties to the infant mortality rate. But what I really want to acknowledge is that we have the statistics to support the maternal labor and delivery moment,
Hmm.
but it's actually a larger crisis about Black women's health,
Yeah.
right? This is not
Interesting.
isolated to a woman's ability to reproduce, right?
Hmm.
This also shines a light on the deficit of, you know, lesbians in the LGBTQIA community. If we were to focus in, we'd see challenges there. We're looking at whether it's older pregnancies of people who are above the ages of 35 and teen pregnancy. So this is across the board. And this is really just being able to shine a light on the Black women's health crisis of believe Black women when we say we're in pain or whatever's going on. But again,
Hmm.
we're really able to use the labor and delivery maternity moment as a key indicator where we know that women are transitioning already, in life and in community.
So one would have thought, and I want you to, I know I saw you on a hearing recently about Cedar Hill, and I want you to talk a little bit about that, because that, we thought, and we still are hopeful, will have an impact on these statistics. Is the hospital really gearing up for the kinds of things that you're talking about? You talked about, the connection with Children's Hospital. You talked about bringing doulas there to the hospital. Is because before, women had to leave the ward to go and have their babies, right? They had to go across the river to have babies. So what's happening now? What's changed, if anything, or what's changing?
Great questions. Great questions. One, having Cedar Hill Regional Medical Center in Ward 8 is a game changer. Like, just point blank, hard stop, that's a game changer. We haven't been able to have babies in Ward 8 for quite some time, right? Since the closure of UMC's labor and delivery department. But now we're able for our folks to have babies in community. So that in and of itself is a game changer. But
Hmm.
then when you add on top of that the other kind of wraparound resources and support that we're also trying to embed, again, another game changer. It's not often that a hospital seems to be, well, I don't know of any hospital in the area that's trying to embed doula services within it, right? And so that again, their willingness and being open to that type of conversation is a game changer. And then I'll also add on top of that the pediatricians at Cedar Hill are children's doctors, right? Hard stop. Those pediatricians come from Children's National Medical Center. So again, if we're talking about wraparound embedded services, we're really trying to do something different and unique in Ward 8. And what I will say, I know that there's been a lot of conversation, a lot of bad stuff, a lot of bad press going on, right? I ask folks to give us grace because one, we've never built, like the folks who built this hospital have never built a hospital before. We didn't know what we didn't know until we didn't know it. Not that that's an excuse, but I'm very much understanding that there's some things that we just didn't know. And then
No,
I
for
also,
I just want you to clarify, because you're talking about the hospital in the excessive terms. So you, for disclosure, you also serve. Do you serve on the board of the hospital?
Yes, for disclosure, I do serve on the board of the hospital, but I am not an officer, right?
Right.
So I am on the board as a community representative.
Okay.
And I am always trying to advocate on behalf of Ward A residents and make sure that our health and the promises that were made to Ward A residents, remains true, regardless of the new people who are sitting in the seats.
Okay. I am, just real excited about this conversation. I'm sorry that John was having, technical problems, and we'll get him back on soon. But, you can probably answer one of the questions I was going to ask him, which is, for this Maternal Health Week, April 11th through the 17th, is there any activities that you can share that folks need to, might want to participate in or join?
Absolutely. It's a community baby shower happening. We're really excited for the community baby shower that's happening. There we go. It's on the screen.
Yeah.
April 13th, right around the corner. Didn't say I am a Ward A resident, a proud Ward A resident. And at Community of Hope, Wellpoint is hosting a community baby shower. We're really excited for what this means in community. It's going to be diapers, pregnancy resources, food, giveaways. Really, really excited to kick this off in the Great Ward 8, specifically the Bellevue community, with a number of community partners coming out to just make resources available to our folks and our birthing people.
That's going to be, we'll give the address out there for Atlantic Street Southwest for Atlantic Street.
Absolutely.
Okay.
So that's in Southwest, right off of South Capitol Street. For folks that don't know, it's
Mhm.
at Community of Hope, fourth, four Atlantic Street. It's not too far for some landmarks from the Auto Zone on South Capitol Street. If you're familiar with the old Good Food Market, the Lockridge and Bellevue Library is right there on the corner. So it's right there on Atlantic Street, right off of South Capitol Street in the Great Ward 8, hosted by, in collaboration with Community of Hope.
Now, is this open to everybody? I mean, who would want to come?
This is open to everybody. This is any mom, any birthing person. Come out and see what the resources are. If you've recently had a baby, you can come on out. If you know somebody that has a baby, come out and find more information, more resources. We'll be out there in full force celebrating our new moms and our newest members of the Great Ward 8.
Wonderful. That's fantastic. And lastly, I mean, as far as the council is concerned, I know that you all hold monthly meetings. Talk about that. What happens at those meetings, and is the public invited to attend?
Absolutely. The public is invited to attend. We meet the third Wednesday of every month. So next week we'll be meeting again. We meet from 10 to 12 and our locations vary. Traditionally, we're hosted at the University of the District of Columbia, the old Congress Heights School, 3100 MLK, right at MLK in Alabama. When we're not at that location, we're at the DC Department of Health over behind the big chair over on Shannon Place. For anybody that wants to find out more information, please go to ward8healthcouncil.com.
Okay. All right. Good. Good. Jaren, you're full of information, full of positive information. And in the words of our late leader, Reverend Jackson, we say, keep hope alive. I hear a lot of hope in your voice, and that we will be able to talk one day about a statistics that's completely different than the one that we opened up with. I think that I'm going to assume that's your mission.
Absolutely. Absolutely. I want to make sure that if my daughters choose to have babies in the Great Ward 8, that the reality that they're birthing into is different from the one that they came into.
Wonderful. Thank you so much for being with us. Have a great day.
Thank you.
All righty. And thank you for being with us today on Let's Talk. We've had some enlightening conversations with the Public Service Commission about the critical issues surrounding utilities, and we've explored the vital work being done by, at least the event being done by Wellpoint. We'll get them back on again to talk about some of the other initiatives that they have, and also the Ward 8 Health Council. All of that addressing Black Maternal Health Week, April 11th through the 17th. We encourage you to stay engaged, whether it's by reaching out to your local representatives about utility policies, or sending us an email at news@washingtoninformer.com. If you just have questions that you want us to forward to some of these folks, we'll be glad to do it. and by supporting organizations like Wellpoint and the Ward 8 Health Council. Those meetings are open to residents, so I hope that you will join and become a part of the solution to the really to many of the issues that we have, that people are having in the community. But we always say the answers to, or the solutions that we're looking for, we already have. They're within us. So all of that will help us to make some positive outcomes, some positive differences in the communities in which we live. Continue to watch Let's Talk, advocate, and support each other. Next week, we're going to have our monthly Reporters Roundtable. We want you to join us. We're going to be talking about some of the hot issues that are affecting our community. Our reporters, Sam Collins and Stacy Brown, and our editor, Misha Green, and Jada, all the team will be here to talk about the stories that we've been covering over the past month, and maybe our predictions about things that are coming up, particularly as it relates to the upcoming DC elections. There's a lot going on. The debates and the community forums are heating up. So there's a lot for us to share with that. So with that, I'm going to say thank you very much again for joining us, and we will see you here next week. Have a wonderful weekend. And I don't know whether to tell you to stay cool or stay warm, but whatever, just stay well. Take care.